Hi, everybody. Dr. Lee Coleman again. And I am especially happy to have you join me today because in this session, I want to ask you to really focus. This is not a session that might keep you here just for stories about particular cases or fun and interesting vignettes, but critical thinking about what is psychiatry in relation to what is medicine. And as a result of some of the issues I'm going to bring up, to better form your own opinions about what role should psychiatry play in our society. Should it have the powers that it has, the influence that it has? And the way that I want to do that is through the issue of words. Being critical in your thinking when you hear the way words are used. And are the words being used honestly, or are the words being used to mislead you? Let's leave out the issue of whether people doing it on purpose. That's too subtle to worry about for right now. We can assume that people are honest when they use the words, but that doesn't mean that they're correct when they use these words. So what am I talking about? I'm talking most especially about the use of the word diagnosis in psychiatry. So let me just tell you right off the top, psychiatrists don't diagnose people. They can't do it. They would like to do it. Certainly, if they could do it, they wouldn't have to be constructing these rather deceptive arguments to allow themselves to maintain their privileged position in medicine. But because they can't do it, you're going to see how that all plays out. Okay, I think that in order to really study the question of what is diagnosis, because it has such power once people accept that word, and whether or not psychiatrists really know how to do it, what we need to do first is examine what real diagnosis is. And then once we have that under our belts, we can move on to ask ourselves, is that what psychiatrists do or not? Okay, diagnosis, the concept is really pretty simple. Diagnosis is when you determine the cause of the patient's symptoms, or the cause of what's wrong with your computer, or many other things. The diagnosis is when you find the cause. And the presenting problem in the mental health field, what the distress of the patient is, or in medicine, what the distress of a medical patient is not necessarily going to tell you very obviously what the cause is. When medicine, excluding psychiatry, we'll leave open the question whether psychiatry should be a part of medicine, but in real medicine, the doctors start with the patient's presenting problem, including past history. So their subjective feelings and experiences that brings them to the doctor, as well as any relevant past information that goes to their subjective symptoms. That's the history and the presenting problem. Now, what allows real doctors to do a diagnosis is that they can move from subjectively experienced behaviors, emotions, even in a medical problem, but also bodily disorders. Then the doctors have laboratory examinations, scientific instruments, films, x-rays, we all know about that. Now, the crucial difference is these are measurements of the body. It doesn't matter what the philosophical school of the physician is. If they're practicing good medicine, their particular point of view about the world, about human beings, about society, is not going to influence the outcome. If I'm a Republican, I shouldn't worry about having a Democrat doctor, or vice versa, just to pick a silly little example. So there are objective measurements of the body and the functioning of the body which lead the doctor from the presenting symptoms, the distress, to the cause. And when we have the cause, we call that a diagnosis. Psychiatrists never can do that. Not because they're not smart people, not because they're not dedicated people, anything like that. It's because the nature of the area that they work in. Emotional and behavioral problems do not have known physical causes, despite the desperate speculations and wish fulfillment that psychiatry has foisted upon us as a society. They have found no causes for mental and behavioral disorders. Because they have found no causes, they can never diagnose anybody. But psychiatry most desperately wants to be seen as being able to diagnose people, because that's what legitimizes their position in the allocation of funding, in getting, if you're a researcher, if you are wanting to get paid for the therapy that you're providing with people, if you are a member of an organization like the American Psychiatric Association that wants to continue to get the money they make from the diagnostic manuals, so-called, that they put out, funding for projects that they want to do. And if one of the allies, the pharmaceutical industry that they have, wants to maintain these record profits, it all is resting on the idea that psychiatrists can diagnose people, that the drugs are addressing a particular disorder that has a physical cause. Why else would you put these drugs into people if you didn't think there was something wrong in their brain? We'll talk about that a little later. Where is there a possible use for medications where you don't know the cause? Possibly, but it would be very, very different than what we do now. So psychiatrists don't diagnose people. What is it they're doing? They are simply rephrasing what the presenting problem is. So if you have depression, as we all understand it to be, low self-esteem, low energy, loss of interest in normal activities, affecting your appetite, your sex life, suicidal thoughts, some degree of this, you are going to be labeled as having some kind of a depression. Now, is that really any different? Have you really learned anything? Well, the people who defend the idea that psychiatrists are adding something and that these labels are special, they will support it on two bases. One, they will say, is that we have a lot of experience. And therefore, what we conclude, how we choose to categorize your symptoms, is a step ahead. They also say that we've arrived at our categorizations by a consensus. We've spent a lot of time meeting with each other. And that's what these diagnostic manuals that they keep pumping out about every 10 years are based on, the consensus opinions of people with experience. Well, let me ask you, because I think you should be able to get the answer without any help from me. Is experience by itself sufficient to render something reliable and scientific? The history of the world would indicate that experience in the sciences does not progress unless it is backed up by independent data that can be verified. When you cannot prove whether you're right or wrong, that is the dividing point between science and everything else. Feedback, corrective feedback from independent measures. Experience does not necessarily do that. And you will never know if you have the right idea unless you can test it. And to use experience to arrive at consensus is just one more step along the same path. Consensus is not science. The whole history of science is actually where people were relying on certain ideas that failed because they had no data. Just an example that pops into my mind was when I was a medical student, women with breast cancer had radical mastectomies done, and all the surgeons were convinced that you needed to remove a wide swath of tissue to reduce the chances of a recurrence of cancer. Take as much tissue as is necessary to reduce down to the lowest possible level the chance that there was still cancer there. It was only when statisticians and medical researchers who were not the surgeons, not qualified to do surgery, who gathered the data to show the outcomes were not justifying this radical procedure. So psychiatry cannot overcome the problem of false so-called diagnosis by either consensus or by its experience. And researchers, if they're going to continue to try to find genuine causes of mental disorders, that's one thing. But be aware that as of today, they have not been able to do it, and they've been forced to make a lot of admissions that 30 years ago they were desperately claiming they had found the causes. Let's talk a little more about the implications of the difference that I've explained to you between genuine diagnosis that medical doctors engage in than the misleading so-called diagnosis, which isn't diagnosis, that psychiatrists engage in. When doctors find a diagnosis, if the treatment is effective or not effective, it doesn't cause them to change the diagnosis, unless there's something else that comes along in their testing and workup procedures which should lead them to change what they think is the cause. But ordinarily, they just keep trying to do their best with whatever measures are available to treat the diagnosis that they have found. So you could say that diagnosis is a finding that leads to the treatment. But in psychiatry, diagnosis, so-called diagnosis, is really a strategy. That is, you have a strategy first, and then you pick a label which rationalizes what the strategy is that you have. What I mean by that is you've learned something about the person's distress, and you make a decision to try a particular drug because in the literature it says that this particular drug is supposed to be useful for these presenting symptoms. Now, the critical difference between psychiatry and medicine is that once you try that drug, if you don't feel you're getting the results that you want, you simply change the diagnostic label. If you have an opportunity to actually follow what's happening with patients, I've seen this happen for decades. You simply change the diagnostic label and say, well, I think maybe this is really a better description of the person's problem, and then you use different medication. Or you add another medication. You maybe try them both. Or maybe you have 3 medications because you say, well, I think this patient has 2 diagnostic labels. And so you can end up with 2, 3, 4 medications for 2 diagnoses. So in that case, it's not that a true diagnosis has led to a strategy, but that you had a strategy and then you picked the so-called diagnosis in order to rationalize it. And then you're free to do it again, change diagnostic labels. So it's a never-ending go-round because you never were able to form a diagnostic label that meant anything or a true diagnosis in the first place. So just to finish up, I want to actually give you a little diagnostic test that you can perform on yourself to see if you've absorbed what I'm saying to you, and if you find it convincing, whether you can apply it to certain situations. If you come across a situation where you hear or you think yourself that somebody you know, or yourself possibly, has been diagnosed by a mental health professional, such as somebody asked me recently, well, what do you think about that? What's the difference between schizophrenia and manic depression? I said to the person, you know, I really wouldn't know anything about what the person was like. I would know something about whoever applied that label, but I wouldn't know anything about the person. So if you hear it claimed that somebody was diagnosed manic depressive, diagnosed schizophrenia, the test is how you respond when you hear that. If you respond by saying, that doesn't tell me anything, I don't really know what was going on with that person, because all I know is that somebody decided to apply a label which is merely that person's feelings or opinions about the behavior of the person in question. So in order to know what the condition is of that person and what I think about it, maybe what would help that person, drop the label and ask yourself, what do I know about the person? If I know people who know that person, or if I know them, what does that tell me? And what do I think might be of benefit to that person? You'll then be acting more as a genuine mental health professional should be acting. But unfortunately, it's not what's happening. Because what you would be doing is you would be trying to learn about the human being. But because psychiatrists and all those who come under their influence adopt this medical model, they want to break up the person into the discrete part of them that has an illness, so-called illness, which makes all kind of sense in medicine, and then say, I'm going to treat that part of the person. And if necessary, we maybe even force it on them. If you don't do that, if you refuse to do it, if you will not be fooled by this pseudo-diagnosis and simply make inquiries about the person, you'll be way ahead of the psychiatrists who are desperately maintaining their power and prestige, and primarily doing it by passing off subjective summaries as though they're making medical findings. Thanks a lot for coming, and I'll see you next time.